Depolarization versus repolarization. Introduction. Every heartbeat depends on two repeating electrical processes: depolarization and repolarization. Depolarization activates the heart muscle. Repolarization resets the heart muscle so it can respond to the next heartbeat. A simple way to remember this is, depolarization turns the electrical activity on. Repolarization prepares the cells to begin again. The resting cardiac cell. Before a heartbeat begins, cardiac cells are in a resting electrical state. The inside of each cell is more negative than the outside. This difference in charge means the cell is polarized. The cell is ready to respond, but it has not yet been electrically activated. What is depolarization? Depolarization begins when an electrical impulse reaches the cardiac cell. Positively charged ions move into the cell, causing the inside to become less negative. This electrical change activates the cell. Depolarization then spreads from one cardiac cell to neighboring cells, producing a traveling electrical wave through the heart. Muscle contraction follows this electrical activation. So depolarization does not mean contraction itself. Instead, depolarization is the electrical event that triggers contraction. Depolarization through the heart. The normal electrical impulse begins in the sinoatrial node, also called the SA node. It first spreads through the atria. Atrial depolarization appears on the ECG as the P wave. The impulse then travels through the AV node and into the ventricles. Ventricular depolarization appears as the QRS complex. Because the ventricles contain much more muscle than the atria, the QRS complex is much larger than the P wave. 225 to 305. What is repolarization? After the cells have been activated, they must return to their resting electrical condition. This recovery process is called repolarization. During repolarization, positive charge leaves the inside of the cell, allowing the inside to become negative again. The cell is not being turned off permanently. It is being reset so it can respond normally to the next impulse. Muscle relaxation follows this electrical recovery. Therefore, repolarization is the electrical event that prepares the heart for relaxation and the next heartbeat. Repolarization on the ECG. Ventricular repolarization appears on the ECG as the T wave. The T wave is usually broader and smoother than the QRS complex because ventricular recovery happens more gradually than ventricular activation. The atria also repolarize. However, atrial repolarization normally occurs at about the same time as ventricular depolarization. Its small electrical signal is therefore hidden within the much larger QRS complex. Why the ECG returns to baseline? The ECG mainly records electrical differences between different regions of the heart. While depolarization is spreading, some cells are activated and others are still resting. This difference produces an ECG wave. When all the cells in a region are similarly depolarized, the tracing may return to the baseline. That does not mean repolarization has already occurred. It means there is no strong moving electrical difference at that moment. When repolarization begins spreading, another electrical difference appears, producing the recovery wave. Final summary. Let us summarize. Depolarization electrically activates cardiac cells, begins the process that leads to contraction, creates the P wave in the atria, and creates the QRS complex in the ventricles. Repolarization restores cardiac cells toward their resting electrical state, prepares them for the next heartbeat, leads toward muscle relaxation, and creates the ventricular T wave. The easiest memory phrase is, depolarization activates, repolarization resets, contraction follows activation, and relaxation follows recovery.